Hello, I'm Dr. Kumar Saraswat. I'm a consultant psychiatrist at Mindcare Peace Center, Jalna. And today I have the opportunity to talk to you about suicide. We often hear in media regarding suicides, and we also hear that Mr. So and so committed suicide because of a fight in the family, in a fit of rage, or due to financial issues. What these news items fail to acknowledge is that very frequently suicidal ideas, suicidal attempts, and completed suicide are actually related very closely to mental illness, particularly depression. Just like coughing is a symptom of chest infection, so also suicidal ideas are a symptom of mental illnesses. Some common illnesses in which suicidal thoughts are prominent include depression, bipolar disorder, schizophrenia, delusional disorder. So the first thing to keep in mind is that when there are suicidal ideas, the thing to explore is whether the person is suffering from any mental illness. This is important because mental illnesses are treatable, and when they are treated, the suicidal thoughts also go away. Now, coming to suicidal thoughts they come with certain signals. They come with some warning signs, and these warning signs include typically the patient feels helpless, no one can help me, hopeless, there is no way out of this situation, and worthless. I'm a person of no worth. These these symptoms frequently co-occur with suicidal ideas. The person may also feel extreme anxiety, restlessness, and guilt. What can a person do when he is experiencing suicidal ideas? The best thing to do is to say it out loud to your near and dear ones. Okay, this includes your family, your friends, your relatives, your acquaintances, and if none of these are available, to your doctor, to your therapist, or your psychiatrist. And if you are having suicidal ideas, it is uh, it is wise that you consult a psychiatrist or a psychotherapist early as possible, because early treatment of any mental illness reduces the chances of completed suicide. As to what can you do when a near one complains of suicidal ideas, the first thing is to hear him out, reassure, and not to leave the person alone. Certain precautions need to be taken when a person complains of suicidal ideas, and that is not to leave the person alone, not to indulge in alcohol or drugs. See that the person is not indulging in these things, because when these things come together, the chances of a completed suicide are pretty high. So the best way is to tell it to a near and dear one, and the best thing you can do is to seek help as soon as possible. And the cause of suicide isn't usually outside. The cause of suicide is usually in here, in the mind. Mental illnesses are the closest correlate of suicide. So my take-home message would be this: anytime you or your loved one experiences suicidal ideas, it is wise to seek help from a mental health doctor. Thank you.